going to the next slide again. And Medicaid encompasses several health insurance programs for people who have lower income and assets. We're going to just talk today about programs that are for elderly and disabled people and that wrap around Medicare. They all have different income and asset limits, and you can call in Milwaukee, the Milwaukee Enrollment Services at 1-888-947-6583 to try to apply for these benefits. You can also call us at Senior Law at 1-855-947-2529, and one of our benefit specialists can give you a benefit checkup to find out what programs you might qualify for. I'm going to go on to the extra help slide. Extra help, or the low income subsidy, is not a prescription drug plan, but it's something that helps pay for your prescription drug costs. You have to provide information about your income and your assets, and Social Security will determine whether or not you qualify for this program. Some people automatically qualify for it. If you have Medicare and full Medicaid benefits, you automatically qualify. If your only income is supplemental security income, you will qualify. And if you get a Medicare savings program, you will automatically be enrolled into this extra help program. So I'm not going to talk too much else about it, but it can help with premium costs, deductibles, and co-pays with your prescription drug plan. There's several levels of it, and again, it just depends on what your income and assets are. So again, you can call and somebody can help you determine whether or not that is something for which you qualify. Medicare savings programs are another type of Medicaid. These programs pay for Medicare premiums. One level of the Medicare savings program also pays for Medicare deductibles and coinsurance. That level is called QMB, and if you are below 100% of the federal poverty level, your assets for a single person are less than $7,860, you may qualify for QMB. It'll pay both Part A and Part B premiums, and it'll pay your Part A and B copays and deductibles. The other levels of the Medicare savings program generally just pay for the Part B premium. But it can save you a lot of money. And, as Dan mentioned earlier, the Part B premium is $144.60. So it's well worth checking this out to see whether or not it can help you and whether you qualify. Next slide. Senior care. Senior care is a specific to Wisconsin program. It's called a State Pharmaceutical Assistance Program. You have to be 65 or over and a Wisconsin resident. It is actually a prescription drug plan. So it provides creditable coverage and covers most common medications. For people who take no real prescription drugs, it's a good option because, as Ginger talked about earlier, if you don't take your Medicare Part D prescription drug coverage when you first turn 65, you will incur a penalty. Well, this plan, this senior care, you can take instead of a prescription drug plan, and it only costs $30 every year per person. And it does, cover, lots of medications, and it will help you avoid getting a penalty. You can apply for Wisconsin Senior Care by going to the Senior Care website. There's a very simple 2-page application. You can have Senior Care and a Part D plan as well. They kind of work together and can help save money on medications. The people with higher incomes may have a spend down and a deductible. Next slide. The key points to remember: Medicare is a health insurance program. It is not free. There are a lot of costs associated with Medicare, and there are many ways to get coverage within this program. You have to make a lot of choices about how you want to get your coverage within Medicare, and it is complicated and confusing, but there are people who can help you. Again, you can call Senior Law at 855-947-2529 for assistance, and the Medicare Helpline can help you with that too. I think that we'll get the numbers to them later, right? So you have to make the right decisions. You have to make sure you're making these decisions within the correct time frame, and make sure if you need help that you ask for it, because there are lots of people who can provide that help to you. And there's a list here on this slide about different places that you can contact to get help and assistance with your questions.
Thank you, Pamela. Well, that will conclude our presentation. I'm sorry we did run over a little bit. And again, thank you everyone for joining us today to talk a little bit about Medicare. I hope we were able to answer some of your questions, and do feel free to contact any of us if you have any further questions. And thank you to the North Shore Library System for allowing us to do this and present this to you. Thank you, everyone, and have a good afternoon.
Yes, thank you as well to all of you for presenting. It's been really informative and helpful.
And I just want to mention for everyone that in addition to providing a good referral for objective Medicare counseling about any of these topics, the Milwaukee County Department on Aging provides a wealth of services and referrals for services for you. And their Aging Resource Center number is 289-6874. So if you are a resident in Milwaukee County, your Aging Resource Center number is 289-6874. And I'd really encourage you to take advantage of the information and assistance, as well as benefits counseling that is available through our center. Every county has an Aging and Disability Resource Center, and they provide a wealth of information about many topics relating to older adults. So thank you.
Great. Yeah, and I typed that phone number in the comments in case you're looking for it. And again, we will be posting this on the North Shore Library YouTube page as well. So that should be up by next week. So if there's anything you missed, you wanted to hear again, you will be able to find it there as well. And I didn't see any questions come up in the comments section. I did see Jillian said that the ADRC also has elder benefit specialists and disability benefit specialists who can help people with enrolling in Medicare. So I wanted to mention that because I thought that would be helpful. Otherwise, I think we have covered everything unless anyone has any further questions. Thank you again to all of our presenters and for those who are attending. We appreciate it very much. All right, everyone have a wonderful day and stay safe.